It's American Heart Month, and 22 News is working for you tonight by getting facts on your heart health. Joining us tonight live over Zoom is Dr. Sabine Chaudhry of the Heart and Vascular Program at Bay State Health. Dr. Chaudhry, thanks so much for being here with us.
Thank you for having me.
So we talked in the last half hour about strokes. Blood clots are a major risk for heart attack and stroke. So what causes blood clots and what can be done if it's determined that you do have one?
So there are different reasons for blood clots. We can get blood clots in our veins as well as our arteries. And the way that that happens is slightly different. In arteries, which is where we worry about the risk for heart attack and stroke, plaque buildup is a very big contributor to blood clots forming. You can think of that lining the artery and then creating almost like a rough edge that other blood cell components can attach to, and that increases the risk of a clot happening. Certain other conditions and risk factors like smoking and diabetes increase inflammation, and that also can increase the risk of blood clots forming. Other conditions like atrial fibrillation, which is a different heart rhythm, can cause blood clots to form within the heart and then travel places. And that is a different reason to get a stroke. Again, blood thinners are a very important way that we treat these different risks of clots forming, and then modifying things that you can modify in your lifestyle. So having a healthy lifestyle is a really important way we reduce our risk of heart disease as well as stroke.
Yeah, and so sometimes surgery is necessary to deal with heart issues. I want to have you talk about some of the major types of procedures that are out there.
Absolutely. So, years ago, the mainstay of how we would fix heart blockages and heart valve issues would be open heart surgery. We have a spectrum of different types of procedures now that can help manage heart disease. In some cases, people absolutely need open heart surgery to have bypass surgery, where we actually take other arteries and veins and bypass areas of blockage to get better blood flow to the heart. We also have open heart surgery that helps us replace or repair heart valves that may be very leaky or narrowed. Some of those things can also be fixed with percutaneous procedures. So procedures where we take catheters through arteries and reach the heart without having to open someone up. And we're able to open some types of heart blockages that way. We're also able to fix certain valve issues that way as well. And that's been very helpful in treating many patients who may be at too high a risk for open heart surgery.
And so lastly, I want to ask you this. A lot of people take daily aspirin to lower their risk of heart attack or stroke. So is that something that most people should do over a certain age?
I'm so glad you asked that. So, years ago, based on older trial data, we were recommending that many patients, especially over the age of 50, take an aspirin to prevent a stroke or heart attack from happening. In recent years, a number of trials have looked at this, and they have not shown a benefit to prophylactically taking a baby aspirin to reduce your risk of heart attack or stroke. If you've already had a heart attack or stroke, you absolutely should be taking aspirin, and you should continue that the rest of your life. The data, if you've never had any of those issues, however, doesn't seem to bear out risk reduction. And in some cases, it actually increases your risk of GI bleeding. And that's why we've kind of pulled back our recommendation, because we don't want people to have increased bleeding. In some populations who are at high risk of heart disease, those over the age of 65 with diabetes and other types of medical problems, you may still want to consider a baby aspirin prophylactically. And that is a great conversation to have with your regular provider to figure out if you're in that high risk bucket where it's something that should be considered.
Okay, Dr. Sabine Chaudhry from Bay State Health, thank you so much for all that great information tonight.
Thank you for having me.